And welcome back again to part 4 of our practical revision class. And in this section, we will be talking about, um, I'm going to be talking about urinalysis and urine specific gravity together because, of course, they are together, they go hand in hand. Like I always say, this is a alternative to practical revision class. We've done the practical. I did that myself. You saw it in class, we did in the lab, we did everything. But in preparation for your forthcoming exam, I decided to record this video so that you have something to keep on listening to while you are busy doing other things, to be able to refresh your memory of all we did in the lab. So that is why we will not be performing the actual practical, because we've performed the urine specific gravity. Urine specific gravity is the ratio of the density of urine to the ratio of the density or to the density of distilled water. I don't know if you get that. I said urine specific gravity is the ratio of the density of urine to the density of distilled water. And it has a specific range. Anything below it, anything above it indicates that something is wrong somewhere. So the normal range for the urine specific gravity is between 1.005 to 1.030. Let me repeat it again. I'll put it on the screen. The specific gravity is between 1.005 to 1.030. That is the normal range for urine specific gravity. Anything above it, anything below it indicates that something is wrong. Why is urine specific gravity important in a physiological situation or human beings or in a physiological setting? One, it shows the health of the kidney, or how good the kidney is functioning, or the kidneys function. It shows how our hydration status, if you are well hydrated. Also, it shows or indicates the presence of solute such as glucose or protein in the urine, like when they do it for the pregnant women or in pregnancy. Most women who have kids, they are used to some of these tests, urinalysis tests, because most times it's being done to check for protein and glucose in the urine, because protein and presence of protein in the urine in pregnancy indicates preeclampsia. With high blood pressure. When there is when there is an increase in the blood pressure plus protein in urine indicates preeclampsia. The glucose in the urine shows that diabetes is somewhere lurking around. So let's continue. There are some situations where the specific gravity will be greater than 1.030, and it shows that the urine is very, very or more concentrated. So we have such as dehydration. When an individual is dehydrated, the urine tends to be more concentrated. When there is glucose in the urine or glucosuria, it shows in the urine, specific gravity will be elevated. Proteinuria, urine specific gravity will be elevated. Vomiting or diarrhea, when somebody's losing more fluid, it causes a concentrated urine. And when there's reduced fluid intake, it's also as a result of, it leads to urine being more concentrated. And also, low specific gravity of urine also has its own consequences. So anything less than 1.005 in urine shows that urine is more diluted. And this could be as a result of excessive water intake. Maybe when you are overly hydrated, because you consume a whole lot of water, more than what you are supposed to take. Or or another thing is also the inability of the kidney to concentrate the urine, or when there is chronic kidney infection. Also can lead to a low specific gravity. And there are various methods of checking or for measuring urine specific gravity. We have the urinometer, which is what I'm holding here. And this is what we use in physiology lab. You have all seen this. What I'm holding here is called a urinometer. Can you see it? It's called a urinometer that I'm holding. You can also use the refractometer and urine dipstick. This is urine dipstick. This is urine dipstick. And this is urinometer. So these three methods can be used to check for specific gravity. So I've given you a little bit of the theoretical aspect. Let's go further into how the experiment is done. First off, I'm going to start with the aim. The aim is to determine the specific gravity, and the apparatus will be that we used during our class practical section is we use the urinometer, and we also use the dipstick. And have a measuring cylinder. It comes with a measuring cylinder and the urine sample. So what you do, make sure that the cylinder is clean. A subject empties pees into the cylinder, and you gradually lower your. Let's assume that this is the cylinder. We gradually drop it, lower it, and you leave it, and you take your reading. It's going to float. So the urinometer is graded, has gradings on it. Has gradings on it. So it's graded. So it's a difficult experiment to do. So that's just as simple as A, B, C. So it ensures that it flows freely without touching the slide. So when you drop it, make sure that it doesn't touch just the way it is like this. I don't know if you can see it. Just the way it is. It should not be touching the body, or it should just be floating and be on its own. Then you read the upper meniscus. So you take the reading at the meniscus level. I mean, you see it when you dip it, you'll be able to see at the upper meniscus level. You take your reading. So that is how simple it is using the urinometer. So let's use, for example, when you get a urinometer, most times we usually get, I think the one we did in the class, we had a specific gravity of 1.020, which is normal, which falls within the normal range. So that is it. So I want to talk about the precautions you have to put in place when performing the urine specific gravity. One, the urine should be fresh. Two, the urinometer, which is this, the urinometer should not touch the walls of the cylinder, the measuring cylinder that contains the urine. And you don't read like this. You read, let's assume this is my eye level. I read it this way, or you can leave it and bend so that you'll be at the same, or you can raise it up and read at the same, at eye level. And remove air bubbles if present. Before you start. So let's do one or two possible questions that you can as well find or see. So we can ask you, what is urine specific gravity? Define urine specific gravity. And it's simple as, it is the ratio of density of urine to the density of distilled water. What is the normal range? the normal range for urine specific gravity is between 1.005 to 1.030. Okay. And we can also ask you which instrument is used for specific gravity for in urine or for urine. We use excess of for reasons. We can also ask you to state condition in which urine specific gravity is high. We talk about dehydration, vomiting, or and diarrhea. We talk about proteinuria. In this case, the specific gravity will be high. For situation, maybe we'll not ask you should state conditions where specific gravity is low. You talk about excessive water intake and chronic kidney failure. So this brings us to the end of this section. Okay, talk about the dipstick urinalysis test. So this is the dipstick. Let me show you. This is what it looks like. I don't know if you can see it. And this is what the container looks like. So I said the aim is to examine the physical and chemical characteristics or properties of urine. And for the apparatus and methods, one, apparatus, we have the dipstick. You should be able to identify it when we place it on the table and say identify specimen A. Know that specimen A is Urinalysis dipstick. Look at it. Sorry. If you can see. So that is it. So let me just briefly explain the procedure before I explain. I said the aim is to show the physical and chemical characteristics of urine or properties of urine. You get a clean cylinder, measuring cylinder. You empty, ask the subject to produce urine, or the patient. You dip this into the urine. Let's assume this is a cylinder. You dip it right into it. Allow it to stay in for about 10 seconds, and you bring it out. Make sure you blot out the excess urine from the body, and you place it against the standard, because on this body has a standard what it should be. So you place it beside against the standard, and you take your reading. For this, you check. This checks the specific gravity. Like I say, it shows specific gravity with indication of different colors. It shows the presence of pH. Different colors shows different things. The different pH. We have leukocytes, which is the white blood cells. We have nitrites. It shows indicates nitrites. We have protein, and it shows the different, whether it's +1, +2, +3. We have glucose, also indicates glucose. We have ketone bodies or ketone. We have urobilinogen. We have bilinogen. We have blood, and we have hemoglobin. Okay, we have blood. Then we have blood. So this shows a whole lot about the function, about the health or physiological state of an individual. This single dipstick, it can show a whole lot, or say a whole lot about an individual's health status. So it's just that. So for your practical, you should be able to identify this and say what is being used for. Okay, so I think that is it for this.